Hi, I'm Dr. Johnny. Thanks for joining me. We got a big discussion today. We're talking the non-surgical facelift, RF radio frequency energy versus HIFU, high frequency ultrasound. And I'm going to talk about, does it work? If it doesn't, why doesn't it? Can it melt your fillers? Can it melt your threads? Should you do it? Could you be scammed? Why? You got it done, didn't see the results? What are some of the possibilities? Let's dive into that. The non-surgical facelift, everyone would want it, and it does have a role. Let's go. So I'm also going to show you a device, and I think that's going to help people understand. Sometimes when I answer questions on other videos, should I get this? Should I get that done? And there's so many, including home devices. So if you like our videos here, click like. Remember, subscribe to keep your skin and body beautiful, healthy, and vibrant. My goal is to educate and give you concepts. Radio frequency and high frequency ultrasound are two of the most common procedures called the non-surgical facelift. They work by heating the tissues, and therein lies the crux of a lot of what we're going to talk about today. Radio frequency is more electrical type of energy, and of course, HIFU is the ultrasound type of energy. And they work by creating heat at the level of the skin and just the subdermal area. You can target the fat area too, and that's a good conversation that we'll have. But the heating creates collagen. And that is shown in histological studies, it's shown in patients who enjoy the results, and it's shown after successive treatments where people get additive benefits of doing more. Now, some of these will have a consumable, which means that when the clinic gets you in there and they fire up that machine, immediately they're paying $200 to $500 to an external company, maybe even more. So we want to get it all done in one day because it's costing that clinic money. Some people talk about, and you'll see online, hey, it took the fat out of my face. And heating through both of these devices can target the fat if it gets too hot, if it gets too deep. Why would that be an issue? Well, my face isn't particularly fat. Maybe on camera, but in real life, it's not particularly fat. There are areas that I want to target fat, but another person, we may be targeting fat because they have jowls, they have heaviness down here, whereas someone like myself or someone who's thinner, the last thing you want to do is get rid of fat. The beauty of these devices are that they can get the fat, and a problem with the devices are that they can get the fat. And you'll see body sculpting devices out there that also use high frequency ultrasound, radio frequency, and other heating, even through laser wavelengths that target fat. So we know that. I believe they more so make the fat leaky. Of course, fat cells, we have a finite amount. They shrink and contract for a living. So a lot of times people feel a little gaunt after. That will typically improve as the fat cells gain. And that's also why people like to do these treatments over time, and they like to do them successively. So where they might come get their fillers once or twice a year, they might do these treatments more often. So which one should you do? Radio frequency produces heat, we know that, like thermage. I'm going to show you a machine today that can go to different depths and target them, and it's going to give you the concept of why it's so important who does your treatment and what device you choose. If someone isn't quite getting the result they want because maybe you have a high expectation, maybe you're not a great candidate, or maybe you have fat and skin and they don't have a device that can get to the fat layer and the skin layer at the same time. So that person is going to amp up the heat, and as they amp up that heat, they're going to get the fat layer, and you may or may not want to get it. And of course, there might be a fat layer here that you want to get, but not here. So the technician really wants to be attuned, and you want to know who's doing it, how much experience they have, and communicate exactly what you want. Couple that with a device that might have an expensive consumable, they're trying to get it done all in one session. And if you come back and you say, show me the pictures, I don't see a result. Of course, these things work over the period of several months. You might not see the result, so why not turn it up high? But in turn, they might get the fat. You see the catch-22 there. And then there's the patient who doesn't qualify for any of these treatments if it's radiofrequency or high-frequency ultrasound because they have bone loss, they have structural loss in the tissues, meaning they need some filling, they need some lifting, and they need some deeper collagen production, and that's why we often use combinations together. So for me, I like high frequency ultrasound in a tunable device that doesn't have a high consumable where the person using it is pushed to get that treatment right and heat the skin excessively. My preference for my clinic and myself is radiofrequency. And let's go to the machine. I want to show you there's two types of radiofrequency. There's bipolar, meaning the electrical energy goes from one lead to the next, it jumps. And there's unipolar, which means it has a transducer, and then there needs to be a pad somewhere else for that energy to travel. Thermage would be an example of a unipolar, and bipolar would be the one I'm going to show you, which is a Viora device. Let's go look at the treatment head and give you an idea. So now looking at this device, you see the bipolar heads that we talked about. If I was getting a treatment done, I would want more concentrated here at the edge of the mouth where there's some fat. The last thing I want is, at this point in time, fat removed from the submalar, or I might look gaunt and hollow. Not a good look for a lot of people. And I would also want it targeted to the submentum to tighten and to shrink the fat cells. So whoever's doing my treatment, I want to feel more warmth here. I want them to focus here. I want some along the jawline, but to tighten the skin. So I might go to a different level in the fat with radiofrequency and another layer where I just want the skin. And then, of course, you have masseter along the jawline. If you take a forehead as example, I want it very superficial. I want to maintain all the fat in my forehead because as we lose fat in the forehead, it falls. The skin doesn't have support. We get wrinkles, and we never want to put toxin in the forehead. So that gives you an idea of why the technician's important, why the device is important, and why you need to be an appropriate candidate with appropriate expectations. It's all very complex, but very navigatable because it's a matter of communication and finding out what device your provider's using and whether that fits your bill and whether you can continue to keep coming back, because I prefer to do these over a few sessions, or when people come in for the neuromodulator, we can then, hey, let's contour that jawline again. Let's lift the brow again. And of course, we didn't even get into body today, but you can do combinations with Sculptra and radiofrequency as well. So it's very versatile. I did a video on will it melt your fillers? So you can certainly go and watch that video. I think it's great. There's a lot of good information there. Think about what temperature I talked about this getting to, and think about the temperature that fillers, before they leave the factory, are often autoclaved. They're heated to high temperatures, way beyond what this is going to get to. Same with threads. It can release a thread, and you can go to my video on PDO thread complications and the #1 thread complication. And radiofrequency, particularly this device, works because it sucks the skin and then heats as it pulls. Very effective for straightening out a thread irregularity. But not all devices will, and the thread itself, I've heated it here in my clinic, in my little lab where I have all these threads in water and acids and bases, and I've heated it. The thread does not seem to soften to the temperature, and it certainly doesn't melt it, okay? So what we're doing is we're taking the tissue and the fat in the skin around it, heating that, and we're relaxing the thread. And with this device, of course, there's suction as well. So that's radiofrequency versus high frequency ultrasound. It's about the temperature, it's about the technician, it's about your expectation, and it's about whether you're even a candidate for it. What I can say is there's very high satisfaction when people meet those. When people go in, they think, They look amazing, and they say, oh, everyone thinks I'm 40, but I'm 60. And we see them, and I go, well, you kind of look 60. You probably need other things first, like plasma sculpt, like fillers, like jawline fillers, like PDO threads. And then this we might do afterwards, because it's kind of like the icing on the cake. For the younger people, we can stick with collagen building, heating, non-injectable products until they then need it. So there's a continuum. The consult is most important. Thanks for joining me today. Subscribe here, click like, join me on Instagram. I'll see you on the next video to keep your skin and body beautiful, healthy, and vibrant.